I treat patients with various endocrine disorders, including diabetes, and I see patients both with type 1 and type 2 diabetes in my practice.
If I can provide the support sources, technology, devices, better products that make their diabetes a little bit easier for them to manage and control, and then I feel like I've done a better job for them.
Excellent relationships and trusting relationships between a physician and a patient really can take patients to the next level.
It's really making sure people know about what options they have and individualizing it, because everyone is different.
When we intensify the therapy by giving them multiple daily injections of insulin, compliance is a big issue.
Patients have a busy life and they may forget to take the injection, delay the injection. They're out of the house and they don't have what they need.
The first time I prescribed CeQur Simplicity was to a patient who was really resistant to starting insulin for a lot of reasons. And then luckily we had the option of CeQur Simplicity.
Having an option where it's simple, it's worn, it's essentially a wearable insulin pen that can be given really discreetly under the clothes. So CeQur Simplicity is very easy to start a patient on. It's simple for the patient, but it also is very simple for the healthcare provider.
It's always on the patient. So the patient fills it and wears it. And whenever they need a mealtime bolus, they can just squeeze it and get their insulin.
It is very simple and easy to use. You administer insulin very efficiently and effectively.
Keeping things simple for our patients with diabetes who are dealing with so many complex things is really helpful.
It just takes away a lot of the burden of constantly having to fill a syringe with a vial or constantly having to get the pen needles out and dial the pen.
The ease of injecting insulin, which was one of the biggest hurdle in getting your patients to goal, has been simplified by CeQur Simplicity.
The first thing they say is how much easier this is to be able to have a wearable device that provides them their mealtime insulin wherever they are, no matter what they're doing.
Patients are always just effusive about the improvement of quality of life with reducing the burden of injections.
Have you prescribed this? Have you showed it to your patients? Have you gone online and looked at it?
Try it. All of us have patients who struggle with compliance. I think it's a great option.
This is a very simple, easy method that healthcare providers that have not used it can adopt, and it does improve the quality of life and compliance.
I recommend prescribing it. I encourage you to learn about it and offer this solution to your patients.